Hello, everyone who is just joining. Welcome to Modern Health webinar. We'll give everyone another minute just for people to trickle in. And in the meantime, feel free to use the Zoom comment section to say hi. And maybe if you had any prior experience with coaching, personally or professionally, feel free to share what it was like. Thanks, everyone. Okay, thanks everyone who just joined. I'm Julius from Modern Health, and I'll be helping Myra today to moderate this webinar. If you have any questions for Myra throughout the webinar, please use the Q&A feature of Zoom to post them. And if you have any general comments, technical issues, or experiences you would like to share about coaching, please use this chat section. There's a ton of content that Myra is about to share, and I'm super excited about it all. So I'll pass to her and we will get started now. Thanks, everyone.
Wonderful. Thank you so much, Julius. Really appreciate it. So thank you all for joining on, it's Tuesday, I believe, this afternoon. Time blurs a little bit with COVID. But my name is Dr. Myra Altman. I'm a clinical psychologist by training, and I'm the VP of Clinical Care here at Modern Health. So my background is in obesity prevention and treatment research, so doing outcomes research. I've also been a clinician providing care primarily for health psychology, anxiety, depression, using evidence-based approaches. Moved from there to a postdoc in value-based healthcare, and then joined on with Modern Health right at the beginning, and really think about our care model holistically. How do we provide really high quality, really effective care for folks across the clinical and subclinical spectrum of mental health needs? So I have become a coaching convert over the last many years. I moved from being a total skeptic to really passionately embracing coaching, and hopefully I can share kind of how that change has happened for me and answer any questions that you have. So in terms of the agenda today, really want to think about what are the mental health trends that we're seeing in 2021 as we kind of move past the year of 2020, how we think about the role of coaching in a mental health solution, and then how and why we studied coaching effectiveness, what we're seeing from our research on the impact of coaching, some implications and next steps. But just want to reiterate what Julia said as well. Please feel free to send questions through the Q&A as we go. I would love to make sure I'm answering all of your questions, and feel free to put them in the chat as well. But maybe just to start off, I'm sure this comes as no surprise for anyone, but really 2020 was an incredibly difficult year for many people. I think one of the silver linings that came out of the COVID crisis, racial injustice, climate change, all the things that we experienced, is that there has now been this massive focus placed on mental health. We see that companies are prioritizing mental health more and more. You can see that dramatic jump in how many times mental health is mentioned in earnings reports. To me, this is just an incredible change. I don't think I would have predicted that we would see this rapid increase in focus on mental health, which obviously as a psychologist, I think is really long overdue. But we're also seeing it on the employee side as well, where the majority of employees think it's important for their employer to offer more mental health benefits. I think this speaks to kind of the level of need there is, and that current solutions through health insurance, through EAPs often don't meet that need for folks. And then we also see that most think that it is the responsibility of their employer to provide that, much in the same way that they provide physical health benefits, dental, vision. So really starting to see mental health become that fourth pillar of benefits offerings. The other thing that we're really thinking about a lot at Modern Health is we know that mental health issues have been increasing over the last several years, both because the actual conditions increase, but also because as stigma goes down, more people are raising their hand and asking for support for mental health conditions. But we think that this is just going to really accelerate post-COVID. So you can see almost every CEO that was spoken to as part of a Fortune and Deloitte survey agreed that mental health would be a priority even after the pandemic. And I think that that obviously makes a ton of sense when we think about what the long-term impacts of COVID will be. So really most people are projecting that we're going to see this wave of mental health problems post-COVID as people really cope and process the impacts that this year has had on them, whether that's fatigue, PTSD. We're hearing a lot of folks experiencing a lot of anxiety as they consider going back to work, but obviously from the year as well, lots of loneliness, isolation, depression. So there is this huge number of folks who are experiencing mental health concerns now and that are at risk of developing mental health conditions in the years going forward. So I think there's never been a more pressing focus to think about how do we make sure that we're getting care to all of these folks that need it. Unfortunately, the existing solutions are not set up well to solve for this need. I'm not sure if anyone here has tried to find a therapist or tried to get mental health care, but you may have experienced sort of the frustration of trying to find someone in network or trying to go through an EAP and not having therapists or not finding someone who's accepting new patients. So we know that when folks are at their highest risk, when they're really willing to reach out for help, there are so many barriers in the way that it's hard for them getting connected to a therapist. There's a lot of reasons for this. There's actually a significant shortage of therapists. You can see some of the stats here, but 150 million people in the US live in areas where the therapist to resident ratio is 1 in 30,000. We're seeing about 30 to 40% of people during COVID saying they have a clinical diagnosis of depression, anxiety. So we're looking at 4 in 10 people that are potentially struggling with mental health concerns, and only 1 in 30,000, 1 in 10,000, 1 in 1,000 therapists available. So there's sort of this really interesting and problematic situation where there's a huge increase in demand for mental health services, a huge number of people who need that care, and not enough providers to support that need. And so that's really kind of one of the large impetuses for why we created Modern Health and why we have thought about from the beginning coaching as a really important part of solving this need. For us, it's really about how do we make sure that we're getting people the level of care that they need, so getting the right care at the right time, but also making sure that providers are operating at the top of their license. And this is a really critical value-based healthcare principle where we want to make sure, if you look at a physical health comparator, right, you want to make sure surgeons are doing things that only surgeons are able to do, that nurses are doing things that only nurses are able to do, medical assistants, et cetera. That hadn't really been applied in the mental health space. And that's kind of really where we were thinking about it. How do we make sure, given this level of need, that psychologists, that therapists are really operating at the top of their license? They're seeing only those folks that they're truly only qualified to see. And coaching becomes a really, really interesting example of a paraprofessional workforce that can provide a lot of support for folks who are in that mild to moderate range. I'll pause there just for a quick second and see if there's any questions about kind of the landscape of mental health needs, where kind of coaching potentially fits in before we dive into a little bit more about what that means and what that looks like at Modern Health.
Nothing yet, Myra. We can continue.
Perfect. I always like to start these off by saying I'm a psychologist, so I love to sit in the awkward silence. So once we get to some more Q&A, I will sit quietly until someone asks a question. So I think we're seeing these two trends combining, right? So there's this massive increase in need for mental health services and clinical needs in the population, but we're also seeing a really interesting shift in how people think about the support that people receive. As work life becomes more integrated, as folks are working from home and flexibility becomes a huge focus, what we're seeing is that more and more employers are moving away from this idea of the employee experience to life experience, that we are whole people that exist in our workplace, in our lives, and how do we make sure that those are working well in sync so that someone can show up to work, be their best self at work, be their most productive, engaged, happy employee, but that also means that they are engaged, productive, and happy in their lives as well. So all of these topics that were previously not really thought of as part of mental health are becoming thought of as part of mental health. So everything from financial stress to sleep, kind of anything that someone might be going through. So that's kind of really where we pulled these two kind of significant needs together to create our comprehensive mental health care delivery system. The real goal of this system is to make sure that we're providing the right level of care at the right time for both what people are going through and what they need and want. So you'll see that we think about mental health as along a spectrum of needs from red to green. Red is kind of where we typically think about mental health. When you say mental health, folks usually think mental illness. They're usually thinking of that red category. So those are folks who are already experiencing a clinical condition. So maybe they are experiencing depression, anxiety, PTSD. And we want to make sure that those folks get the most intensive resources, that they're getting therapy, adjunctive support by some of these other modalities. But our goal for that group is really to get them better. We want to recover from symptoms. We want to recover from depression and anxiety conditions. But then you think about these folks further along the spectrum, where folks in the yellow and orange, I would put myself in that group today, right? Where there's a lot of things that we're experiencing. There's a lot of accumulating stressors. And the real concern for that group is that that's going to then progress into a clinical condition, which obviously becomes much more impairing for the employee, for the person, but also has impacts on the organization, on healthcare spend, on productivity. So we really want to keep those folks in the yellow and orange so that they can really flourish and ideally move into the green. And then there's folks who are in the green who are maybe doing pretty well, but want to proactively and preventively engage in their mental health, really go from a position of doing okay to really how can they flourish and do really, really well. And so for us, the really important piece is how do we have a range of offerings to meet people's needs across that green, yellow, red spectrum. So we have a lot of different modalities of care. We have one-on-one therapy. So that's from a licensed clinician, psychologist, licensed social worker, et cetera. We also have two different coaching offerings, and that's what I'll talk about for the most of this presentation, where we have mental health coaches, we have coaches, and then we also have group sessions and digital care. And people can engage in one or many of these types of care. The other thing that I think is important to think about is how do we make sure we're focusing really holistically on anything someone might be going through. So whether that's their emotional needs, stress, anxiety, depression, or their relationships, their physical health, their professional well-being, or their financial stress. And so how do we intervene as early as possible, give support on whatever area of life someone is struggling with so that they move upwards from red to yellow to green. A little bit more about how this works in our product. So upfront, we do an assessment where we find out what the level of clinical severity is for someone. So are they in that green, yellow, or red bucket? We use validated clinical instruments like the WHO, the GAD, and the PHQ to figure out their level of severity. We ask folks what they want to focus on. So people could select 3 from the emotional topics, professional, financial. We also ask about functional impairment. So that's for us a really, really critical question. Is what you're going through impacting your ability to work and live? What's the impact it has on your life? And then my favorite question we added in about 6 months ago now was, how do you want to receive care? I think there's a prevailing belief in the field that everyone wants one-on-one care. And what we see is that there's pretty wide variations where less than half of folks want one-on-one care. A lot of people want self-guided digital care, and some folks want care as part of a group. So typically across the population, we see the vast majority of folks fall into our yellow-orange group, fewer in the red, and folks in the green as well. Based on that assessment, we're going to triage you to a personalized care plan that's made up of kind of one-on-one care options, groups, digital content. You can move between these, you can use multiple offerings. But what I'm going to really focus on for the purposes of this conversation is the coaching component, because I think for a lot of folks, that's the most new. And as I said in the beginning, I think there's some skepticism around coaching that we really want to make sure we're addressing. Let me pause there again and just see if there's any questions that have come up on anything I've shared so far.
I see a question about how do you make sure coaches are high quality?
Yeah, really great question. So maybe I'll provide a little bit of context on just what coaching and therapy are and the differences between them, and that will help, I think, answer that question. So therapists, I think folks are generally more familiar with that, typically master's or doctoral level clinicians. So they're licensed in the US context in the state in which they practice. Globally, it might be country specific. We screen all our therapists to make sure they practice evidence-based care. So they're doing care that's been shown by research to be effective. We screen for cultural competency and ethical decision making as well. Coaching is a little bit of a newer field and it's fairly unregulated. So technically anyone on this call could hang a proverbial shingle and call themselves a coach. So I think that's where a lot of the skepticism around coaching comes from. But what we do at Modern Health is make sure that we are only using coaches who have a significant degree of training and certification. So for us, that means that they're qualified by the ICF, the International Coaching Federation. We also do a very rigorous screening process, including a sample session with all of our coaches where we're assessing evidence-based care delivery, professionalism, cultural competency, and then onboarding them onto our network. And then we do a lot of training for our coaches. So for our standard coaches, they go through a training on high risk assessment. So how do we make sure they know what that line between coaching and therapy is, that they're triaging when appropriate, and then also general principles from cognitive behavioral therapy, acceptance and commitment therapy, so that they're kind of integrating these really well-researched therapy practices into their coaching care. And then we do a lot of quality assurance after the fact where we look at, we have a composite provider quality index where we take into account the engagement that they get from members, the outcomes that they see, satisfaction ratings, et cetera. Mental health coaching is a little bit different. We actually developed this in response to COVID where we were seeing a huge amount of need. Our mental health coaches go through really extensive training in approaches like cognitive behavioral therapy. And it's built on a framework from the World Health Organization. So you can almost think of mental health coaching as between therapy and coaching. And we're seeing a really important need being filled there for folks in the orange. Other questions? I see there's a question in the chat about the difference between coaching and chat and mental health coaching and chat. So yeah, our chat, we really think about there being a video-based care as a core component of the coaching experience. So our coaches, whether that's coaching or mental health coaching, will meet with members for video sessions. So that's really critical for building a relationship, creating change. But you can chat with your coach, think about it like an instant messaging service between, usually for things like accountability, scheduling, check-ins. So my coach will, ask me if I was doing that meditation that I said I wanted to do, for example. And again, the difference between coaching and mental health coaching is the focus of care and the level of qualification of the provider. So coaches are more likely to be working on professional issues, relational, social. Mental health coaches are really more likely to be working on emotional issues. That being said, we're all human. It's very hard to totally separate those. So that's why we make sure our coaches are all really trained up in the emotional aspects as well. Alrighty. Let me move forward now to talk a little bit more about our research. So I kind of just shared a lot of a background around coaching. So really when we were thinking about our research, we wanted to make sure we were doing some rigorous analyses to make sure that coaching really was effective for our population and it was doing the things that we wanted it to do. When we think about research at Modern Health, we focus on 3 core pillars. So we primarily focus on the clinical effectiveness. So is our treatment modality, is the care we're providing, creating individual improvements in mental health and well-being? So our members who are going through coaching, seeing improvements in their well-being, reductions in stress, anxiety, depression, et cetera. We also think about organizational effectiveness. So how does the care we provide improve the outcomes that matter to organizations, whether that's functioning, so their ability to do their jobs, to kind of show up at work, productivity. We look at absenteeism, presenteeism, burnout, things like that. And then cost effectiveness is really that 3rd pillar. Does engaging with Modern Health really impact behavioral health spend or comorbid medical condition spend? So we always focus on kind of what data do we have from our members? How do we make sure we're being really rigorous and kind of getting this back into the academic research? So I will jump in now to coaching effectiveness. So as I mentioned, this was kind of really one of the first areas we wanted to study. As I've mentioned, we know that access to therapy is a really significant challenge. So we wanted to evaluate, could coaches who are trained in evidence-based mental health delivery models be a really effective form of care that increases access and increases affordability? So we wanted to evaluate, does coaching improve well-being, burnout, absenteeism, and presenteeism? For the purposes of the study, we looked at a group of 530 employees that went through the Modern Health experience towards the latter half of last year. We only included folks who had an assessment before a first visit with a provider and after a visit, and they were only using coaching. So these folks were not using therapy at all. And then we were just looking at changes in well-being from baseline to follow-up. What we found was, I think, really, really promising from in terms of how coaching could play a really important role in meeting the needs of the mental health for the population. So we saw that significant increases in well-being after 4 visits. So if someone met with a coach for 4 30-minute sessions, we saw that they showed improvements in well-being on the WHO-5, which is a really fantastic validated measure of general well-being and also depression. What we also wanted to do is look specifically at folks who are in that dark orange and red area. And we actually saw that employees who started with elevated symptoms of depression, 40% of them experienced a clinically relevant improvement in care. So that means their score increased by 10 points. What's so exciting to me about this finding is that it actually is really in comparison with some meta-analyses of the impacts of therapy. So oftentimes you see about 40 to 50% of folks doing therapy in a randomized controlled trial seeing these levels of recovery. So it really suggests to us that a lot of people, even folks who are in that light red, can be served by coaching. We also saw that there were significant improvements in burnout. So folks increased from baseline to follow-up, and also we saw many folks experience clinical recovery from burnout as well. And then we saw statistically significant decreases in presenteeism as well. So when folks were at work, they were really at work and showing up in a meaningful way. So again, this really indicated to us that coaching could be a really effective and scalable solution for folks who have mental health needs. So what this tells us is that kind of making sure that you have a broad range of offerings is really critical. Not everyone potentially needs a therapist. And so what that means from a system level is you can start to get more folks working with a coach on mild to moderate concerns, prevention, and really free up that limited supply of therapists to work on the cases that are much more complex, that have high levels of comorbidities that really only therapists are qualified to see. So again, we're wanting to get everyone operating at the top of their license, make sure folks are getting the right care at the right time. So this paper is currently under review in a journal, so really excited to get this out into the academic literature as well. And then I wanted to share some kind of hot off the press data that we've recently analyzed that we're submitting for publication as well, where we're taking those really, really promising results from coaching, and we wanted to say, how does this compare to therapy or kind of blended care with coaching plus therapy? I won't spend too much time here, but just to kind of really summarize what we're seeing, we see folks who are just engaging in assessment, so a self-guided format, we do see them increase their well-being. That's not a clinically meaningful change in well-being. What I think is really exciting is that we're seeing comparable changes in well-being for folks who are in coaching and folks who are in therapy. And these are all folks who are doing 2 or more sessions with a coach or a therapist. So the cutoff for a clinical improvement in WHO-5 is an improvement of 10 points. And so we're seeing that in both our coaching and our therapy population, which is really, really exciting. What's interesting too is that you're seeing that even a little bit higher when we combine coaching and therapy together. So there's some really interesting indications here where you can potentially create a blended care plan for someone that encompasses both coaching and therapy and really boosts their outcomes, particularly for folks who are in the deep red. And just to chat briefly about the odds of clinical recovery, what that essentially means are people who are engaged in coaching more likely to recover than folks who are in the assessment only group. And so you can see for folks engaged in coaching, they're 2.5 times more likely to kind of achieve clinical recovery, which means they moved below a clinical cutoff to above a clinical cutoff, about 1.5 times more likely in therapy and 2.5 times more likely if they're doing both. So again, all of this is really telling us that coaching can be a really, really viable option. What's next for us is to really think about how do we make sure we're getting folks to the right level of care at the right time. I'll pause there and just see if there's any questions here. Are folks surprised by these results? Does this line up with what you would be expecting to see? So I'll just pause for any questions. All right, well, I'll keep moving along. I would love to hear if folks can just throw in the chat, does this make you more or less likely to want to see a coach yourself for mental health concerns? Does this change the way you think about coaching at all? I would love to just kind of hear from folks in the chat, yeah, how they're thinking about coaching and therapy. We're doing a lot of additional research here at Modern Health as well. I'll just give you some highlights of projects that we're working on. We're currently looking at what predicts modality preference. So who wants to engage in one-on-one care versus group care versus digital care? Does that change based on their clinical risk, their demographic preferences, what they want to work on? So we're really excited there because it'll allow us to further personalize that care experience. We're also really looking at the impact of digital care. So digital cognitive behavioral therapy, meditations, kind of what's the impact of that as a standalone modality, if that's all folks are doing versus blended with one-on-one care with a coach or a therapist. And then, as I mentioned before, also really looking at what the impact on health claim spend. We have lots of other projects in the works, so also open to any other kind of questions or things that you wish that you knew about the mental health field that potentially some of our research could help answer. And I love that I'm seeing in the chat that someone realized coaching is beneficial, but I think seeing the data really does make a difference. And something that we really think about a lot at Modern Health is how do we make sure we hold ourselves accountable to doing really rigorous analyses and then getting that out into the academic literature so that we're moving the field forward, but also making sure that we're incorporating those changes into our product and continually innovating. Any other questions for me at this point?
I see a question whether people will have access to these slides. So yes, we'll send a follow-up email to all the attendees. We'll also include the 2-page summary of the research paper. I also just posted it in the chat if anyone wants to read it.
And certainly we welcome follow-up questions if there's something you want to dig into a little bit deeper, whether that's how we do the analyses or particular measures we're looking at. Certainly always happy to answer those questions in the follow-up. But also encourage you, we have a fantastic fireside chat coming up with the Chief Talent Officer at Procore, Pat Walder. So that's bound to be a really fascinating conversation about kind of the mental health impact at her organization and how rolling Modern Health out has helped. But yeah, we'll also kind of put a plug. We're always thinking about kind of what are innovative ways that we can meet the needs of the population. I think coaching is one really, really important way to do that, but we're also investing in group-based care. And so we've been hosting circles. Many of these we've actually made available to the broader public, so you don't have to be a Modern Health client or member to join those. So a lot of those are really focused on meeting kind of some of the acute needs that we're seeing come up for the population, whether that's healing from racial trauma, managing political anxiety, Black Lives Matter series. So really encourage you all to check those out as well. Feel free to share those with your network and your organizations if it's something that's of benefit.
And Myra, there is a question. What's the best way to address secondary trauma in the workplace?
Yeah, that's a really, really great question. So there's a lot of incredibly impactful treatments for trauma broadly. So there's some cognitive behavioral therapy approaches like prolonged exposure, cognitive processing therapy, excuse me. So kind of making sure you're adhering to those evidence-based approaches. I think when you get to secondary trauma, and I will caveat with I'm not an expert in trauma, but the impacts of those can often be very different, but sort of pernicious because there often comes almost a gaslighting component with that where people don't really validate and acknowledge that as a trauma experience. And so my philosophy there is always, how do you make sure you're validating what someone's going through and then pulling from evidence-based research to address that need? So that would be, I think, a really interesting use case for potentially mental health coaching and or therapy, depending on the level of functional impairment and need. And I think if you're dealing with that in an organization, my recommendation is always to validate what the employee is going through, refer them to resources, and then obviously kind of take a look internally at what are the systems and structures we can change internally to make sure we're creating psychologically safe and healthy workforces. But it's a really fascinating question, so happy to also take that offline and follow up as needed. Wonderful. And Julius threw a survey in the chat. We think about doing research and assessment for everything we do, so would love your thoughts there on whether this was helpful, how we could improve this going forward. But really, really appreciate you all taking some time to join us this afternoon and learn a little bit more about coaching.
Thanks, everyone. Have a nice rest of your day.
Take care, everyone.